Now to our top story this half hour, scoring the Senate health care bill ahead of a possible vote this week. The nonpartisan Congressional Budget Office saying that the Republican proposal to repeal and replace Obamacare would decrease federal deficits by $321 billion over the next decade. Now, the number of uninsured Americans would increase by 22 million over the same period. After the findings were released, a pivotal moderate Republican Senator, Susan Collins of Maine, said she would vote no to advance the bill, joining a handful of her Republican colleagues who have said the same in recent days. Joining us now is former Congressional Budget Director, President of the American Action Forum, Douglas Holtz-Eakin. Douglas, what do you make of the CBO's findings? Because, again, one of the arguments is the CBO has been so wrong in the past. Why do we pay such close attention to these numbers in the first place?
I think it's really interesting that they came down where they did. The Senate spent a lot of effort to target taxpayer dollars much more carefully on the neediest populations. The tax credits are focused on those under 350% of the federal poverty line. They give more money for older workers compared to the kinds of subsidies we saw in the House. The Medicaid provisions basically hold harmless medically needy children, the disabled, elderly, and focus on those who are not in poverty and on Medicaid. Despite all that, CBO basically came up with exactly the same coverage numbers we saw in the House bill. So one way to read this is it's a real tribute to how bad the Affordable Care Act is, because the very first thing that happens is you repeal the mandate and 15 million people walk away from their insurance or drop out of the Medicaid program. And that's really a testament to just how unattractive that insurance is.
Doug, it's Lonnie Chen is here.
Hey, Doug, how are you?
Hey, Lonnie. How you doing?
You know, I'm doing well, except for the CBO report. You know, it seems to me that really the focus here ought to be on this deficit reduction number. This is a big number in terms of what the Senate legislation could do. I'm wondering if you could tell us a little bit about how they arrive at this number. Why is this the more significant figure in your mind? And really, how would you describe the urgency of the fundamental entitlement reform that's contained in this bill?
Well, I think the last point is a key one. If you look at both the House-passed version and this one, which the Senate is contemplating, these are so different from the Affordable Care Act in important ways. Number one, the ACA was a huge tax increase in regulatory burden at a time when the economy is trying to recover from the Great Recession. This does a U-turn, does a $1 trillion tax cut, lightens the burden. It's good economic policy. The ACA was a new entitlement program, an expansion of an old and broken one. This goes the other direction. As major reforms of two entitlement programs, it's better budget and fiscal policy for the next generation. And, as I said, it targets those taxpayer dollars that are available, you know, based on the reality to the right people. So I think the structure of it is an enormous accomplishment and something that's been little appreciated. In terms of the actual numbers, I was really quite surprised at the $300 billion budget savings over 10 years. That was the first thing that caught my eye. And I think the hidden secret here is the reason it saves $200 billion more than the House is the mirror image of why the coverage doesn't go up. The Senate constructed these subsidies in a way that they thought the low-income people would pick them up. The CBO says, no, that's not going to happen. And as a result, there's a lot of savings, and it's really focused on those tax credits.
James Freeman's here as well, Doug.
Hey, Doug.
Hey, how you doing, James?
Good, good. Obviously, the headlines are focused on this number of uninsured. This is the yardstick that Democrats worked very hard to create, basically saying the number of people who are on government insurance programs is really the important metric. But, of course, that's not really a metric of how healthy we are, is it?
No. Well, actually, if you think about it, the ACA, ObamaCare, really was a testament to we will cover people at all costs. We'll write a check of any sort to get coverage numbers up. It's failing miserably. So I'm a little nervous about people who frame this only in terms of how many people get covered.
So I have a question for you. You know, the White House is saying that the CBO analysis just can't be trusted blindly. But I guess, you know, President Trump has said if this legislation can't get passed, if Republicans can't do this, then there's also the crash and burn approach to Obamacare, the ACA. What are your thoughts on that crash and burn approach, and can that work if Republicans can't get on board with this?
I think it's related to the issue of the CBO's scores. So, you know, the question is always compared to what? CBO, by law, has to compare things to current law. So, for example, in Medicaid, it assumes that somehow we can just shovel infinite amounts of taxpayer money into Medicaid and other entitlements in the future without any problem. And as a result, enrollment in Medicaid rises by 5 million. So when you see the CBO scoring Medicaid and reductions in coverage from it, it's against a hypothetical where they're actually covering 5 million more people over the next 10 years that aren't even in there right now. That strikes me as not the realistic choice. The realistic choice is, do we do these Medicaid reforms now, or do we do other Medicaid reforms in the future? Because there is no way that Medicaid can proceed as it will under current law. And that's the realistic choice. Same is true of the Affordable Care Act. Individual markets, they are melting down. The CBO baseline says that they'll expand by 30% over the next 10 years. I don't think that's realistic. So if you look at realistic choices, they are crash and burn in entitlement, crash and burn in the individual market, versus fix some things now. And I think that's a sensible way to think about the choices the Senate faces.
James, politically, if Republicans think that they're going to win on crash and burn, they're kidding themselves.
Yeah, I think well, crash and burn is going to be what happens to their congressional majorities, I would guess, if they do nothing. But, Doug, I wanted to ask you on the economic impact. $1 trillion spending cut, good. $700 billion tax cut, good. But we saw a lot with Obamacare on how it discouraged hiring, reduced employment. Do you see in this reform anything that's going to turn that around, make this less of a liability for the economy?
I think if you look at the House-passed version, you saw both the economic policy at the macro level, the big tax cuts and the entitlement reforms, and you saw these purely age-based subsidies. That meant that if you earned another dollar, your subsidy didn't go down. Those are the kinds of hidden taxes that the CBO singled out as causing 2 million people to leave the labor market. The Senate, in an effort to get more coverage, scaled that back some. They now have age and income-based credits, so it's not quite as onerous as the ACA. It's sort of right in between the House and the ACA. All of this, I think, taken as a whole, really puts it in the right direction, gets people back into the labor force. An important, not much discussed feature of the Senate bill is the option for work requirements in Medicaid, and that was very successful in welfare reform. Would make sense in this part of the social safety net as well. So there's an eye toward getting the economy working better, even as they do health policy.
And I want to point out that also weighing in on this Senate health care bill, one of the biggest players in the insurance market, Anthem, the insurer saying in a statement it believed the bill, quote, will markedly improve the stability of the individual market and moderate premium increases. Again, this is the kind of thing that does not get enough attention, because the biggest issues for people who were buying insurance on these Obamacare exchanges have been they've lost coverage and their premiums have doubled throughout the history of Obamacare.
I think one of the big concerns has been the fact that so many insurance companies are just walking away from this market. You know, the Senate really made a strong effort to keep things in place in 2018. They appropriated the cost-sharing reduction money that's been sort of subject of lawsuits and a lot of political controversy. They poured money into something called a stabilization fund. All of these were attempts to tell the insurance industry, we're not going to let this fall apart. There will be the appropriate reimbursements if you go and cover people. And Anthem basically is reflecting exactly that effort.
Doug, it was great to talk to you. Douglas Holtz-Eakin.
Great. Thank you.
I don't understand why the Republicans, though, can't message this better than they do, rather than giving into the language and the message of the Democrats. I don't understand why they can't message it the way that you do.
Well, I think they really do have trouble with the messaging war, and you know, honestly, I think if you turn this into a discussion about coverage, you miss the larger impact of the bill. And so getting away from an exclusive sort of comparison of coverage numbers is probably the #1 objective.
Doug, it was great to see you as always. Douglas Holtz-Eakin.